My name's Mike. I'm a registered nurse with Hospital Education, and I will be narrating a brief educational course concerning hourly rounding on inpatient units. What is hourly rounding and why is it important? Hourly rounding is proactive, in-person rounding on every patient every hour to ensure that they are safe and all needs are being met. This will help improve patient satisfaction and outcomes while decreasing falls and complications. During the process of rounding, staff will physically go to the bedside and complete a focused assessment using the 5 Ps. When are hourly rounds performed? Day and evening shift rounds will be performed hourly between 8 a.m. and 10 p.m. Night shift rounds will be performed every 2 hours between 10 p.m. and 8 a.m. The 5 Ps. During rounding, the 5 Ps can be used to ensure that all patient needs are being met. They are personal elimination, POTI, pain, positioning, personal items, and presence. Personal elimination, POTI. The patient will be asked, "Do you need to go to the bathroom?" or "May I help you to the bathroom?" The patient will be assisted to the bathroom or offered a urinal. All patients identified as high falls risk or cognitively impaired must be assessed for toileting needs every hour. Prevention of major cause of patient falls, attempting to go to the bathroom without assistance. Pain. The patient will be asked, "How is your pain?" or "Do you need pain medication?" Pain medications, scheduled and PRN, will be administered as needed. Ensure the patient comfort until medication can be given. Positioning. Check to see if the bed is in lowest and locked position. Reposition the patient for comfort and assess the patient for pressure ulcers. Change position on high-risk skin patients every 2 hours. For patients in a Prevalon boot or boots, ensure the proper positioning by looking or feeling to make sure the heel is floated in the opening at the bottom of the boot. If it is not, reposition the heel and readjust the stretch panels as needed. Check to see that all cords are properly secured and positioned for safety. Ensure patient comfort and prevention of development of new pressure injury or the worsening of injuries already present. Personal items privacy. Personal belongings will be placed within arm's reach, including but not limited to bedside table, call light, phone, tissue, garbage can, and water pitcher. The patient will be asked, "Would you like something to drink?" or encouraged to drink fluids if needed unless medically contraindicated. The environment will be assessed to limit the clutter of medical equipment and personal belongings at the bedside, which could create a fall hazard. Prevent patient injury, slips, trips, and falls while trying to reach for needed items. Presence. Listen to the patient and address or follow up on issues. Remind the patient of when and who will be back to round on them in the next hour. Prior to leaving each patient's room, ask the patient, "Is there anything else I can do for you? I have the time." Allow patient to address needs that can be fixed prior to the staff member leaving the room. Addressing the above will help decrease call light instances. Alternate to 5P. The needs of patients with altered mental statuses will be determined by the observation of nonverbal cues, i.e. facial expressions, body language, etc. If the patient is sleeping, respiratory movement should be observed. Patients will not be awakened unless their physician has ordered additional medical care. However, the environment must still be assessed for safety. Remember to assess all needs of patients who are nonverbal or cognitively impaired and who are unable to respond appropriately to verbal stimuli. Documentation. Staff will document their rounds by using the hourly rounding worksheet that is available on their unit. The worksheet will serve as a visual reminder and a means of accountability. The hourly rounding worksheet is not part of the veteran's permanent medical record. Completed worksheets will be turned in to the unit nurse manager. Additional questions. If you have any questions, reach out to your unit nurse manager. Thank you.